Welcome to Nutrition for Nursing Students. My name is Kathy Silver, a registered dietitian and nutritionist, and I will be your host for this video. The goal of Nutrition for Nursing Students is to teach you how registered dietitians work with patients. In this video, I will take you through some of my thoughts and tips when I introduce a person to the dialysis diet. Each month, a person on dialysis gets a report card of lab values. Most of these lab values help to tailor the diet and some medications to the patient. Albumin, potassium, phosphorus, A1C, and interdialytic weight gains are all things that the patient can change by what they choose to eat and drink. Oftentimes, patients get confused with potassium and phosphorus. They both begin with P, and both can lead to heart problems. If a patient's albumin is low, I want to make sure they understand the importance of eating protein. Prior to dialysis, they may have been told to restrict their protein intake to protect kidney function. Now they are being told to increase their protein intake. What they need to understand is that the process of dialysis removes some of the protein from their blood as it is being cleaned. This is especially important for them to know if they are on peritoneal dialysis, since their protein needs are even higher. It is common for a person to have a low albumin just before starting dialysis because they may not have had much of an appetite due to the buildup of toxins. As you can see on this slide, the patient's albumin is 2.8, which is definitely not good. If their albumin was lower the month before, however, I would be acting like a cheerleader and encouraging them to continue their good habits, but if it was higher last month, I would become a detective. The best source of protein for a dialysis patient is protein that has a high biological value. For example, meat, poultry, fish, and eggs. Egg whites are especially good because they are low in phosphorus. Many renal dietitians often encourage patients to have a hard-boiled egg as part of a snack. It is quick and easy to prepare and is very economical. Other forms of protein are Nepro, protein powders, and protein bars. Nepro is considered the official drink for dialysis patients since it is made to be low in phosphorus and supplies about 20 grams of protein. It comes in vanilla mixed berry and butter pecan. However, it is not for everyone. It comes with a whopping number of calories, over 400 calories per cup. I have never had a problem getting someone to drink Nepro when they have a low albumin and their hair is falling out. Protein powders and bars are a great option too, if they are first checked by a renal dietitian to make sure they are not too high in phosphorus and other nutrients. Your patients who like to read food labels may notice that Nepro protein powders and protein bars also contain potassium. All protein foods contain potassium. Just check with the renal dietitian at the clinic to make sure that the protein powder and bars are not too high in potassium. You can see on this slide that this patient's potassium is above normal. It is not in the danger zone of 6 or above, but it is still of concern. This person is most likely on hemodialysis 3 times a week and not on peritoneal dialysis. Patients on peritoneal dialysis often need to be encouraged to eat potassium-rich foods and vegetables. If they do not eat enough foods high in potassium, the doctor will put them on a potassium supplement. Normally, if a patient's potassium is high, they will need to cut down on high potassium fruits and vegetables. But there are other things to consider. If the potassium level increases along with the albumin, maybe the potassium has increased due to the increase in protein. A level over 5 is still not good, but before I would talk to the patient about it, I would look at what type of potassium bath they are on during treatment. If they are on a 3K bath and the potassium is high, they can be changed down to a 2K bath or even a 1K bath. The lower the number for the potassium bath, the more potassium is washed out. To reduce the amount of potassium in the diet, the patient would need to avoid or limit high potassium foods such as bananas, oranges, tomatoes, and potatoes. Avocados are a great source of monounsaturated fatty acids, but they are high in potassium. Spinach may be good in smoothies, but not for a person who has to watch their potassium intake. And sweet potatoes, normally touted as more nutritious than a white potato, is still not a good choice on a potassium-restricted diet. Sources of potassium that you may not think about include bran, chocolate, nuts, salt substitutes, and dried fruits. So what fruits and vegetables can a person on a potassium-restricted diet eat? Low potassium fruits include apples, grapes, pears, and pineapples. It is best to get the list from the renal dietitian. When people consult Dr. Google, they tend to get confused because not all lists of high and low potassium foods are using the same standards for low, medium, and high. Also, portion size is important. Also, there are many low potassium vegetables that can be put in the grocery cart. Salads made with lettuce, cucumber, and radishes are good options. Also, onions and peppers can be put in the cart and can be sautéed for delicious side dishes. And even potatoes can be added to the shopping cart if they are dialyzed when being prepared. Peeling potatoes, soaking for 4 hours, draining the water, and then adding new water to boil them reduces the potassium level. If a person does not want to do all those steps, they can always buy cauliflower and mash them to simulate with potatoes. Another blood value is phosphorus. It is important that dialysis patients realize that the dialysis machines are not that efficient at pulling phosphorus out of the body. To control the level of phosphorus, patients need to take medications. These medications are often referred to as phosbinders. What is important to emphasize is that these medications need to be taken with the meal so that the medications can prevent the phosphorus from being absorbed into the intestinal walls. Patients may need to take phosbinders with the snack depending on if the snack has a lot of phosphorus in it. High biological protein foods such as meat, chicken, fish, and eggs have phosphorus in them. This patient's phosphorus is high. Sometimes it can be a challenge to find out why it's high. Besides not wanting their diet analyzed, many patients forget to take their phosbinders with meals. When counseling patients, some patients like it when I tell them that whole wheat pasta is not recommended. Now they don't feel guilty when they don't eat it. Others have eaten whole grain products for blood sugar control and do not feel comfortable giving them up. Whole grains, legumes, and beans are high in phosphorus. A patient can work with the renal dietitian at the dialysis unit if they want to include some of these foods in their diet. Milk, yogurt, cheese, and ice cream are also high in phosphorus, and pizza would not only be high in phosphorus but high in potassium because of the tomato sauce. Phosphate additives are also a source of phosphorus. At times, these are listed on the label as part of a complicated scientific name. At other times, they are not, since they are trade secrets in some beverages. Phosphate additives are 100% absorbable, where the phosphorus in food is not as absorbable. Other labs include calcium PTH, hemoglobin A1C, URR or KTV, and interdialytic weight gains. If a person's calcium level is high, sources of calcium in the diet need to be evaluated along with any increases that may have occurred in the vitamin D analog they may be receiving during dialysis to control PTH levels. Hemoglobin also needs to be evaluated in the context of diet and medication. Medication is needed to help the body produce red blood cells. URR or KTV may sound confusing to the patient at first, but they are able to quickly pick up on the meaning of these terms, especially if they are sitting for a couple hours on a chair 3 times a week in dialysis. A low URR or KTV means that they may be sitting at the clinic even longer. Doctors want to see their URRs and KTVs high because the quality of their life is better when it is higher. High interdialytic weight gains are hard on the heart since the excess fluid has to be pulled off during treatment. Both nurses and renal dietitians talk to patients about weight gain between hemodialysis treatments. The fluid restriction is between 4 and 6 cups per day. 2 cups of fluid equal 1 pound of weight gain, and it is recommended that patients gain no more than 2.2 pounds per day. High sodium intakes can cause a person to increase their fluid intake as well as to retain fluids. Thus, it's important to talk to patients about the sodium in their diet. Although at this point, when they're on dialysis, most patients know what foods have sodium in it. They know that it increases their thirst and retain fluids. The hard part is not to eat those high sodium foods, especially when they're going out to restaurants with family. You can also give them suggestions for dry mouth. They can include having a mouthwash or buying a mouthwash that is specifically designed for dry mouth, or they can have some sour candy throughout the day, ice cubes, frozen fruit, or gum. And kind of lastly, it's important to remind patients that there are kidney-friendly foods that they can eat and enjoy, and that an example of that would be candy. For some dialysis patients, dialysis is more like a part-time job, and they need to know that they can still indulge in desserts like everyone else. In summary, the dialysis diet is tailored to a person based on lab values. Nutrients of concern are potassium, phosphorus, sodium, and fluids. Monthly lab values are very personal to patients. All want to have good labs, but for some it's more challenging. Both nurses and renal dietitians can help motivate patients to develop habits that lead to good outcomes during dialysis.